Assalamu alaikum and good evening. A very warm welcome to all of you from my side. I'm Dr. Sarah Masood, and today I'll be guiding you about general pregnancy care. So, what's the first thing that you need to do after your UBD or your urine pregnancy test it comes positive? So you need to start taking folic acid right away, and you need to report to your doctor so that she can calculate your weeks of pregnancy and schedule an ultrasound scan at somewhere around 6 to 8 weeks of pregnancy to look for your baby's heartbeat. Now, a lot of females they tend to have nausea and vomiting during the first trimester. That's the first 3 months of pregnancy. So it's important that you take only pregnancy specific and pregnancy safe medicines, because a lot of medicines are teratogenic. That is, they can actually cause structural defects in the baby. So you need to take only the pregnancy safe medicines, okay? And if you have any urinary complaints like burning micturition, or you're having a pain during micturition, or you're having any vaginal discharge, or you're having any fever or sore throat, you need to report to your doctor so that it can be treated in the right time. Okay, then when your second trimester starts, that's after your 12 weeks of pregnancy, you need to shift over to iron and calcium tablets. And what's important is that you're not supposed to take both these tablets together, because they're not absorbed properly then. So it's advised that you take your iron tablets in the morning, and it's advisable that you take with a glass of orange juice or something that's containing vitamin C in it, because it tends to increase the absorption and decrease the side effects. Okay. Then after the 12th week, you can have your dating scan done at around 12 to 13 weeks, and it also looks for the nuchal translucency. That's a screening test on the ultrasound for Down's syndrome. Then moving on to 18 to 20 weeks of pregnancy, you can have your anomaly scan done. It's a very important scan to look for any structural abnormalities in the baby. So it's known as the anomaly scan. You don't have to miss the scan, okay? Then after your 20 weeks, a lot of females tend to develop gestational diabetes, that is development of sugar in pregnancy in layman terms, or a lot of females they tend to have raised blood pressures after 20 weeks of pregnancy. That's known as the pregnancy induced hypertension. So it's important that you have a check on your blood sugar levels and your blood pressures, so that if any such complication is arising, that needs to be treated, okay? Then moving on to the 28th week of pregnancy, you need to have your first shot of tetanus vaccine, and after 1 month time, you need to have your second shot of tetanus vaccine. Nowadays, the coronavirus, you have to have your COVID vaccinations as well.